Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Eli Thompson, Health Education Specialist from South Central Public Health in Idaho. Eli graduated from the New to Public Health Residency Program in September 2024. Eli, I know a lot of your work focuses on opiate misuse prevention and is supported by the opiate settlement. Can you tell us more about what the opiate settlement looks like in Idaho?
Yeah, for sure. First, thank you for having me on. And yeah, we'll go ahead and get into that. The big thing, we'll look at this nationally first for it to make sense. So essentially, the 90s, early 2000s, there was a lot of opioids prescribed, and it caused a lot of damage for people and their families. So there was a big settlement lawsuit group that involved all the opioid manufacturers, the distributors, the retailers, and they were sued for essentially the damages from that. Nationally, it ended up being billions and billions of dollars. There's still quite a few of them that are ongoing. So Idaho is set to receive about 217 million. Kind of depends though. Some are still settling and new ones kind of pop up here and there. But we've essentially have until 2038 is how the payments are distributed. So these payments, they go 40% goes to the state, 40% goes to the city and counties, and then 20% go to the health districts. So it's kind of interesting how it works out though, just because it is based on different sizes. So a smaller town will get less than like a big city or something like that. And same with the counties and even the health districts are looked at by size. But because of that, we're able to do a lot of things for, in terms of education, treatment, and stuff like that. I want to talk about a little bit more. But when we're just sticking to the settlement, really the last thing I'd want to cover there is that a lot of people should know about. If your city or county or health district is receiving these funds, which more than likely they are, because again, it's a national settlement, there's an appendix. So it's called Appendix A, like approved uses. And they did that because they want it to be focused on that opioid misuse, because in the 90s, when there was the tobacco settlements, to my knowledge, there wasn't really anything saying like what it could be spent on. So some of it would go to fix up roads or something like that. With this, it is focused. It has to be within the approved expenses. So some examples, anything related to prevention or treatment, in regards to opioids or drug misuse. What we do a lot of is education. We're all about like prevention being at the health district. Another big thing is Narcan, or naloxone, that's just a generic name, which is the overdose reversal drug. There's a few lines in there that talk about increasing distribution of it or access and things like that, because that's a big harm reduction strategy. So it can be used for that. There's a couple pages all about treatment. So supporting treatment centers, supporting people in recovery, a ton of different things like that. So it's definitely broad, which is great because at the end of the day, if it is related to opioid or drug prevention or getting somebody help, it's pretty much in there. So I think it is definitely a good use and appropriate thing to have, to keep the money spent really where it should be. And then another one too, I think is really good that's in there is drug disposal. We do a couple different drug disposal programs, but the whole idea of funding those is we're removing that off of the street or out of the medicine cabinet before somebody can ever touch it. because, with opioids, there's a lot of prescriptions that can be misused, and that's how a lot of it starts. A lot of times it's just out of the medicine cabinet, things like that. So we have different programs where we help people dispose of them or provide things to properly and safely get rid of them.
Mhm.
Yeah. And then I could go over too, if you want to look at more in Idaho, kind of like what we're seeing here.
Yeah, absolutely.
Okay.
Tell us about that.
So I'll just go over some trends. I will start nationally again just because it kind of makes sense to do. So obviously there's a big, big opioid epidemic right now. Back in 2021 was the first time ever in United States history that we had over 100,000 overdose deaths in a single year.
Oh, wow.
Yeah, and which that's huge. The big thing there is synthetic opioids, mainly fentanyl. Like if you look at a graph of this from 1990 to 2024, there's this huge jump there, and it's almost all synthetic opioids. I think it's close to 80% of it is. Um, so that's been the trend. Uh, in 2023, there was a little bit of a decline. So we went from like 108,000 overdoses to like 105. So not really, it's more of a leveling off than I would say a decline. And unfortunately, it's definitely not where we want it. Idaho itself, so I mean, a decent sized state, but our population's pretty small. We have about 1.8 million people. So we're pretty average on this. With our overdose rate, it's around 20 per every 100,000. And so we had 386 overdoses in 2023, which was our state record. So we've hit a state record every year since 2018, kind of following that national trend.
Mhm.
And again, it's the same story here. Big portion of it is these synthetic opioids like fentanyl. Um, I'm glad to say though, our district, the last data we got, we're the lowest. We have the lowest rate in the whole state now, which is good. So that means
Yeah.
some things are working, especially as the rest of the state's going up. So I'm pretty happy about that. There's a couple programs I think that are helping with that I'll probably talk about today too. Um, I think another thing too, to really go over big picture is how much because I've mentioned fentanyl and synthetic opioids, but how much is really out there and
Mhm.
kind of what's what. So the DEA, the Drug Enforcement Agency, they're the big, federal agency essentially for enforcing any drug laws and seizures and things like that. So last year, 2024, they seized about 54 million of these fentanyl pills. So none of them are legal. None of them come from a pharmacy. These are all counterfeit street pills.
Mhm.
Um, a really interesting thing with them is the DEA tests them to see how potent they are, what's in them, stuff like that. So as of last year, they're at 5 out of 10 of those pills contain a potentially lethal dose of fentanyl. So essentially, if somebody were to buy an illegal pill, it's a 50-50 shot whether there's a lethal dose in there. Um, and a
Wow.
lethal dose is only about 2 milligrams, which, that's like a few grains of salt, essentially. It's hardly anything.
Mhm.
Yeah.
Wow. That's staggering.
Yeah, it's very scary. That's why we try to do a lot of education because things have really changed. I mean, there's no room for anybody to try something or to experiment with something because these days it's like I said, 50-50. If somebody gets a
Yeah.
pill, it could have a lethal dose in it.
Yes, that is very scary, and makes this work even more important to change the environment and get those bills away from where
Right.
people can access them. So, thank you for sharing all of this background. I have definitely been enlightened and learned a lot from what you shared, with the settlement and the appendix. That is especially interesting
Yeah.
and insightful. And I think it's really helpful to understand that broader context of the opiate settlement,
Mhm.
in addition to that impact of counterfeit fentanyl laced pills and those overdose trends. to really see that full picture and then use that information to inform the work that you're doing and people are doing across the US.
Right.
So, how does this information impact your work, especially the efforts towards youth education initiatives that you alluded to?
Okay. Yeah, so when I was hired here, it was specifically for this. So again, this is pretty new funding. So I've been working on it now for a little over 2 years, and it's evolved very quickly, even just in 2 years. Um, Big thing though, for me, and I would say anybody that really takes public health seriously, is data. So, coming in and looking at what's going on, what our communities need was really important. And that is how I arrived to really focusing on that youth education. There's a lot of different things though, like I said, related to Narcan trainings that we've done for businesses or schools or for first responders. One thing I'd like to mention before the youth program is a naloxone leave behind program. So what that is like a paramedic agency goes out to a call, and let's say there's an elderly person and they got called out because they were having a potential overdose from an opioid or something like that. The naloxone leave behind program, the paramedic would go to their family member, whoever's living with them, and say, "Hey, here's this kit. It has a Narcan in it and some other things. In case something like this happens again, you can be better prepared that way, because as soon as you can get somebody Narcan, the better, essentially."
Mhm. Mhm.
So that's kind of the idea behind it. Just people that are at risk of overdose, their family can be more prepared. And then also there's like a social worker. We partnered with a local hospital to do this that will follow up with that person and see what they need. Maybe their prescriptions are unorganized and they need to be reorganized. Or, maybe they need to go back and talk to their doctor or something. So they'll follow up with them, get them help they need, and then provide that to their family in case something like that happens again.
Mhm.
So, but that was one thing I like to mention. I think it's a pretty cool program. It's gotten big nationally, but we're really trying to somewhat pilot it in our area. So we've got quite a few agencies on board now that we're just getting going with that.
That's great.
But
Yeah, thank
yeah,
you for sharing about that program and why it's important to get Narcan and resources to people so they
yeah.
have
And
it sooner.
I think that's a good example too, because there's still a lot of stigma with this type of stuff. So, but that example I provided is something that absolutely happens, in communities across the country. So it's kind of good to look at it in that way or any way really related to overdose because,
Yeah,
it's somebody's family member that you're trying to help out.
absolutely. Yes.
But yeah, so I'll go back though to the about the youth prevention program. So I was looking for something because again, the data showed we needed more education for youth. And then also data shows obviously being very upstream is going to be the best way to prevent things from happening and save a lot of people's lives and time and money and all that. So that's what I ended up focusing my project on for New to Public Health. Um, so when I started that, I'd already been looking for a program and exploring some different ones. Uh, at first, I thought about making one, but then I was trying to be realistic about it though, in terms of, that can take years to really pilot something and know it's effective. And I wanted something that worked now. So what I found was a program called This Is Not About Drugs. And it's through an organization called Overdose Lifeline. So I reached out to them and we were able to get set up. I went through the training to become a facilitator. They gave us the materials and everything. So that's where I went with that. Um, but the program is pretty simple. Like we just go to a class. Usually I went to like health class and things like that. And we would go through um, a lot of the stuff I've been talking about, like just really the scope of it. but then especially resources for people, and then really understanding how common this type of stuff is and like how often it happens and how people can get help for it. Um, and it had like a pre and a post test so we could measure, what they had actually learned if they were paying attention and things like that, which I liked. So that went well. That was uh, trying to think like a year and a half or so ago. So that was last school year. Went really good. Um, I collected data on it for the, new to public health residency, so I could present on that. So I had good data on it. It showed it was working really well. And then we added for this school year another facilitator. So one of my coworkers, she completed the training, so now we're both teaching it. So far this year we've already more than doubled the amount of schools we've been in, which is cool.
That is so great. Awesome.
Yeah. Yeah, so that's awesome. And then I just heard pretty recently that we are gonna help out. They reached out because it's a nationwide thing, and they reached out with the opportunity of piloting a new program. So we'll still run the one because it's already evidence informed, it's been studied. But we're gonna test out another one, and I like this other one because it's like multiple sessions, which the data shows that works quite a bit better. I mean, we can go talk to them the one time, and it does help. But if you're able to go back multiple times, that's something that they'll remember, for months or years at least.
Mhm.
So, yeah. So yeah, that's been going well, and I've definitely enjoyed that program so far.
That is super exciting to hear. And I love to hear that you have trained a second facilitator and that you're working on piloting. Like you said, those one and done programs are good. And when you can go back multiple times, the youth will more likely to remember you and the information and that repetition.
Exactly. Yeah.
Starting younger, going through the grade levels is really what will help this become
Mhm.
a topic that is talked about to hopefully prevent some of the drug use that's occurring.
Yeah, it's amazing. Like, I mean, it's just a way different world now. So, a lot of the youth are already aware of these things. A decent amount aren't though, so it's important that they're aware of how dangerous it is now because it is, like I said, a very, very different environment out there for this.
It really is, yes. Um, so looking ahead, you're already doing really innovative work that is deepening the understanding of the roots of this issue. And looking ahead, what's next for you and your team? Are there any other new projects or collaborations that are on the horizon?
Yes, there's a couple I can think of. One I'd really like to talk about is so Boise State University. We worked with them on things before. Well, I went there for my undergraduate too, but they have I would say a program called Communities for Youth, which is really based around the Icelandic prevention model. So I'd like to kind of explain the Icelandic prevention model. I'm not an expert in it yet, so I'll do my best
Okay.
on it. But really, the general idea of this, it started, it's super, super evidence-based. It's the most evidence-based youth drug prevention thing there is. It started out in the 90s. So Iceland was having a big issue with, underage substance use, essentially. And they created this, they looked into a lot of things and they created this, and they said that they really wanted to have like a community-wide approach to change those environmental factors for their youth. Because, at the end of the day, if you can tell somebody something and they might even know about it, but if they go back into that environment, they might not necessarily have a choice. If they're being influenced by certain people or drugs or things like that, it's really hard, especially for a younger person, to navigate out of that. So the whole idea of the Icelandic prevention model again is really changing the environment. So it looks at like how engaged is the community with the youth, how involved are the parents, what kind of activities do they have? Like in Iceland, a lot of the kids were staying out till 1 in the morning. There was nothing to do, and they were getting in all kinds of trouble. So they implemented activities for them to do or set a certain curfew. Again, all environmental things. Um, so Boise State has communities for youth, and they have already, I know, partnered with multiple places throughout Idaho. One of them is in one of our counties in our health district. So I'm I'm in it at kind of just seeing how it's going. But they're really doing the work on it, and then one of the hospitals here is also doing a lot of the work on it. But what they did essentially is they went into the county. First, they have to build a community structure. You have to have, that's a challenging thing. You have to have everybody on board with it because you need schools, law enforcement, parents, everybody. Because at the end of the day, if you only have one person or one group trying to do it, you can't really change the environment. So they got everybody, they have a really, really strong community, which is awesome. So they were able to pull together and agree to do this. So then Boise State came out and then they do a survey and they see what these factors are. So, you know, like I said, maybe the kids are staying up too late. Maybe they don't have help for their homework. Maybe there's a certain place they've identified where there's drug activity. Maybe they're not getting enough sleep. I mean, there's a million different factors that can be really critical for youth development. So they look at that and then they do the survey and then they meet up and they say, this is what we found. This is what was identified. So let's figure out how to change that. And then it kind of breaks off into work groups. One person's like, all right, we're going to find a way to improve sleep, or we're going to find a way to fix this park, or we're going to create activities for them. So that's really the whole idea. Um, we're in the works right now of leading it. We're building that coalition right now in one of our communities or another one in the district. So I can really get firsthand into that. But again, it's awesome and it really works better than anything else, but it also takes more work, than anything else, which makes sense. Yeah.
Yeah, absolutely. The Icelandic prevention model sounds like a really promising approach and worth all of that effort if it
Mhm.
is, if it works. And coming back
Right.
to those simple terms, and we know that environmental change and having all of those support systems and relationships on board is. So it makes sense to me. So for those who are maybe interested in learning more about this model, where would you recommend that they go to find additional information or resources?
Yes. So we could put a couple links on there, like the Communities for Youth for Boise State. They have their own website, communitiesforyouth.org. And then I kind of just picked one because with the Icelandic prevention model, if you Google that, I mean, there's so much. There's study after study after study on it. It's very evidence-based. So if you like to, read the studies and read the methods and read the outcomes, if you're into that type of data, there's a lot out there. Um, if you're looking for kind of more of just a broad overview, um, planetyouth.org, they have a whole section again that breaks down this model and with different resources and tools in there. But like I said, it's very broad. You could, if you just Google either one of those, there's going to be a ton of stuff that'll come up.
Great. Well, we will link both of those in the video and chat below. And Eli, I cannot thank you enough for sharing your knowledge and your experience with us today. It is really very inspiring to hear about the impactful work in Idaho that you are leading to prevent opiate misuse, substance misuse in general. And for anyone looking to learn more, be sure to check out those resources Eli mentioned. Again, thank you for joining us and for the important work that you're doing.
Awesome. Thank you as well.
Thank you for listening to Field Notes. Insights from N2 Health alumni. For more information, visit new2publichealth.wisc.edu.